Hello, my name is Jennifer Dennis. I am an associate professor of anatomy at Kansas City University College of Osteopathic Medicine at the Joplin campus, and I am very excited to talk to you a little bit about my project that was selected for the SOM Innovation Award in Basic Science, which is specific to a review session that I created known as the HistoHustle. So the HistoHustle was established in 2018 as a supplemental review for our students, specific to whatever histology content we were covering at that point in time in our curriculum. We use a systems-based to-pass curriculum, and so any of our histology content is covered in that same format. I noticed as the key instructor for this content that students weren't always dedicating enough time to it simply because it may not have represented a significant amount of test questions on a given assessment item. And so I wanted to better engage their time and knowledge of this content, as well as honestly increase their level of interest in it and try to make it in a way that was more interesting than what they were already experiencing in lecture. So with the HistoHustle, the key thing that I do is to create 20 to 30 image-based PowerPoint slides that I go through synchronously with the students. And on each of these images, I collect them from a database resource that's run through the American Association for Anatomy, the virtual microscopy database. And I select images that we're currently covering in the systems course at hand. And on these images, when I present them to the students, I include a number of formative first and second order questions that are specific to whatever content we covered in lecture. And this is a verbal back and forth with myself and the students, and I give them time to review the image, assess different key points and characteristics of the image, and then knowing what the question at hand is presenting to them. Now, the key thing about this review, and I think what's most critical about this type of formative interaction, is that students do regularly correctly identify the images and or correctly answer the first or second order questions associated with the image. But what has really become critical to this and its success is that I often ask the students for other tissue types or other structures that they think are represented by that image that were actually incorrect. And what this has led to is that we generally talk about the characteristics of the tissue at hand as presented, but we also talk about the items or distractors, if you will, that they thought that it might be. And actually talking to them about why something is incorrect has been really critical and formative for them in recognizing on an exam what distractors are there as a distractor, but also has helped to cement for them how to correctly identify tissues, especially when you present them with tissues that have similar characteristics to each other. And this has been really critical in systems courses where there are a lot of lookalikes, so to speak. So with this process, it sort of mimics a differential diagnosis that they might approach, that they might use in establishing with clinical presentations. Instead, they're applied to histological images, but it allows them to compare and contrast characteristics that they know for a given tissue versus what they see in the image presented at hand, and as well as negate some of the options that they may think might be relevant to that tissue, but actually are not represented in the image.